Welcome to this explainer. Using Google Notebook, we've pulled together some deeply important insights for you today. Look, if you're tuning in, maybe you or someone you care about are just at the absolute end of your tether. You know that feeling, right? You're completely exhausted. You've tried literally everything, every piece of advice, every external fix under the sun, and yet, that heavy pain and that feeling of being completely stuck just won't lift. I want to start by saying, right here and now, that we see that exhaustion. We really get it. And over the next few minutes, we're going to explore a profoundly different, and honestly, a much more hopeful way of looking at this deeply painful experience.
We're going to kick things off with a pretty incredible quote from Carl Jung. He said, "Who looks outside dreams. Who looks inside awakes." Honestly, that perfectly captures the massive shift in perspective we're going to unpack today. You see, when we're desperate for relief, it's totally natural to constantly look outside of ourselves for the answer. But what if the actual way out of this trap requires looking inside? Not to blame yourself, definitely not that, but to understand exactly how your own internal machinery is running.
And the information we're exploring today comes with a literal life-saving message. There's no such thing as a hopeless case. This framework comes straight from Dr. Joseph Peter Delaney. He's a highly respected health professional. He holds a PhD. He's a chartered scientist, an FIBMS, and an MBSLM. But, here is the absolute most important part about him. He isn't just handing this down from a clinic. He has been there, done it, and got the t-shirt. He knows the darkness firsthand, and he is passing on this message specifically for anyone who feels they just can't take any more. You are not broken beyond repair.
Section 1. No such thing as hopeless. Let's get right into it. Dr. Delaney talks about reaching the jumping-off place. It's that brutal, terrifying reality where you've switched jobs, you've swapped medications, tried therapy after therapy, read all the books, and you still feel totally trapped. But hear this loud and clear. This stuckness, it is absolutely not a moral failure. It's not a sign of weakness. Which brings up a seriously agonizing frustration so many of us face. Why is knowing what to do never enough? You probably don't lack information, right? You know you should sleep more, set boundaries, reach out to friends. But when it actually matters, you feel completely incapable of doing any of it.
Well, here's the real dilemma, and it's a real game changer once you get it. There's a massive difference between having knowledge, knowing what you should do, and having effective power. Effective power is your actual ability to consistently act on that knowledge when you are totally overwhelmed. So the problem isn't that you don't know what to do. The problem is you lack effective power in that moment. This is huge because it beautifully shifts the blame entirely away from your character. It's not about your willpower at all. It's literally about your neurobiology.
Section 2. The nervous system trap.
You see, human behavior isn't just run by our logical, conscious thoughts. Not even close. We operate on this incredibly complex, layered survival system. When we feel stuck, we're usually caught in a profound nervous system trap. Think of it like a biological hierarchy. Conscious cognition, our plans, beliefs, our everyday self-talk, that's just the very top layer. Underneath all that, we have state-dependent memory, our autonomic state, and our deepest, most primal instinctive drives for safety. And when we're chronically stressed or traumatized, those lower, unconscious survival layers, they completely hijack the whole system. Your logic literally gets overwritten by deep, protective instincts.
So the absolutely crucial thing to understand here is your autonomic state. Basically, this is your body's automatic setting for survival. When you experience ongoing trauma or chronic stress, your nervous system actually gets locked into these defensive configurations. It's forced to prioritize fight, flight, or freeze way above rational thought. Fear just becomes this constant, corroding background thread running through your entire life, and it colors how you interpret literally everything that happens to you.
And this is exactly why conventional, surface-level advice fails us so often. If you think about the real drivers of our reactions when we're under chronic stress, conscious choice is just a tiny, tiny sliver of the pie. The massive, overwhelming portion is driven entirely by hidden patterns, our instincts, and that autonomic state we just talked about. External fixes usually only target that tiny little conscious slice. They leave the massive, hidden survival patterns completely untouched. And that is exactly why those deep patterns keep running the show, no matter how many positive affirmations you say.
Section 3. Looking inward for power.
To actually reclaim your power, we have to pivot. We have to start looking inward. And I really want to reassure you right now, there is so much more to you than the faulty internal logic and those fearful patterns currently running your life. Your capacity for awareness, for real connection, it hasn't been destroyed. It's just been completely obscured by survival mode. Think about the contrast here. Looking outward is that exhausting, endless cycle of seeking the next expert, the next medication, the next job to finally fix everything.
Now, external help is absolutely crucial, don't get me wrong, but relying only on it often just keeps the panic going. Looking inward, on the other hand, is this highly effective, entirely secular practice of tuning into your body's internal state. You attend to your autonomic state, your breath, your instincts, so that when you do get external help, it actually has a calm, stable place to land.
This inward work is what Dr. Delaney calls heart-centered intelligence, and it is a scientifically grounded toolkit. It's super practical. First, you just attend to your body. Notice your physical tension without judging it. Just feel it. Second, start observing your darkest thoughts as mental events that are just passing by, rather than absolute, undeniable truths. And crucially, use slow breathing. Try inhaling for 4 seconds and exhaling for 6. That specific rhythm physically calms your fight-or-flight chemistry and starts to uncover the genuine internal resources you've had all along.
Section 4, Heart, Head, then Action. All right, if we want to finally break out of this stuck cycle and replace that old rhythm of panic, spiraling thoughts, and collapse, we need a new operating manual. And it's a simple 3-step sequence. Step 1. Heart and body go first, always. You must settle the nervous system and breathe before you do anything else. Drop the body's threat level. Step 2. Then, and only then, you engage the head. From a slightly calmer place, you can look at your thoughts and ask, wait, is this actually 100% true? And finally, step 3. Action. Take one tiny, microscopic step aligned with what you actually want. The golden rule here? Never, ever try to argue with a stressed mind before settling the body first.
So, to wrap up this explainer, I really want to leave you with a profound question to chew on. What could change if you stopped fighting your mind and started listening to your heart? Dr. Delaney's lived truth and the hard science backing it up proves that you are not a hopeless case. You're really not. You are simply someone who has been trapped in survival mode for far too long, and you are now discovering a powerful new internal compass. The solution you've been desperately seeking out there, it is also, crucially, right in here. Keep taking those small, slow breaths, and please take care of yourself.